Now we are live on Instagram. So, good evening, folks. Welcome to the One Moment Podcast, brought to you by myself, Mr. Ruben Burney, Miss Sierra, and Mr. Trevor. In today's special episode, we decided to since we are a mental health podcast, decided to talk about honor Black History Month, and talk about mental health in the Black community. I think that's a very critical area, very important. I think there's a lot of gaps that need to be addressed. And we also have a very special guest who is joining us today. And we're going to be talking about what they do. So bear with us for a few moments and we'll get to her. Would like to have everybody go around the room and introduce themselves.
Okay, I'll start first. I'm Ruben Burney. I've been a certified alcohol and drug counselor for well over 25 years. I got my start in New York and then moved back to my home state about 13 years ago and was fortunate enough to find a great job in the Pinehurst area. And also I like to use the word side hustle. I have other things that I do on my business is called Live and Thrive. And I do substance abuse assessments for the Department of Motor Vehicle, also for the Department of Transportation. I'm registered with the clearinghouse. That's the Federal Motor Carriers Clearinghouse. And I also do other kind of DWI assessments as well. So I'm glad to be a part of this podcast. It's a learning curve, and I enjoy it.
You want me to go?
Yes.
Okay. Hello, so my name is Sierra Suros. I am a dual licensed clinician in North Carolina. I am also a licensed addiction counselor in South Carolina. And I represent the Place to Heal. We are a mental health and substance use outpatient service. We provide individual outpatient, group, more recognition therapy that's to help with deinstitutionalization. We also do Triple P, which is a accredited program for positive parenting, skill practice development. We just launched our office-based outpatient treatment service, it is a beautiful program where we integrate medication, the prescription-based, though we don't do any dispensing, and we kind of do that with therapy, and we have a great induction program there. So that's super exciting. I am a SAMHSA cadre of consultant. I have been doing that for roughly about 2.5 years. I am also the LPU chair for Fayetteville in North Carolina. I sit on quite a few boards as far as like juvenile crime prevention, opioid task force, and I have been a garden ad litem in Cumberland and Moore County. So I am a very busy little lady. I'm super excited to be here and just be able to discuss mental health with you all and be able to collaborate with like-minded individuals. And I look forward to having a lot of fun today.
Thank you, Sierra. My name is Trevor Zalska, and I am just thankful and privileged to be a professional and who have given me the opportunity to be a member of their group and everything. And
You are breaking up, my friend.
I've got 40 years of 4 of those years surveying. 7 years of that life experience was spent in correction. And so Mexico and the state of America.
Hey, this is what happens sometimes.
Yes. Always says a learning curve. You know, it's practice makes almost perfect. So we're getting there.
Hey, listen, no, 100%. Sometimes, look, the first time you and I kicked off on the podcast, look, we couldn't do anything.
Right,
dude.
right.
We couldn't do anything. I mean, it was freezing up so bad. But it looks like we are recording at a higher rate than what his phone is currently, and it's never done that before.
I think that's the problem. Okay. I think that's what much as I know about technology, the little bit I know, I think that's the problem.
Mm-hmm.
Yeah.
Yeah, which I'm not stressing over that right now.
Yeah.
We will deal with it and tackle the issues as they rise. That's part of being in mental health, right?
Yes.
Right. So look, I'd like to go over our sponsors. We
Can I
have,
pronounce? Can I do the W one?
you can, we're having issues with our website, but yeah, go ahead. And we are really having issues with our website. I think
Okay.
they are updating it, so that's part of the issue.
hmm
But go ahead.
Well, one of our sponsors is Dubby. I used to say Doobie, but it's Dubby Energy Drinks. And reading the information about Dubby is that their energy drinks don't cause the crash effect that a lot of energy drinks do. So, and it's various ingredients in there that's supposed to be healthy for you. So, remember, you get 10% off, I believe, if you mention One Moment Podcast. So again, it's DUBBY energy drinks.
All right. And then we have Miss Patricia Henderson out of Texas. She owns Mindfully Me Counseling. If you go to our sponsors, if you go to our website, onemoment.chain.box, and you scroll down and you click on our sponsors and partnerships, you will see her information at the bottom. If you click on either one of these pictures, the pictures that you see, her logo, or the picture that she has provided us, it will take you to her website. So again, Mindfully Me Counseling with Miss Patricia. She is absolutely an amazing clinician. I've been working with her for a while, known her for a little bit. She is very compassionate. If you are looking for somebody she is bilingual also. So if you are a Hispanic speaker and you want somebody, from that culture, then she is a great choice. Again, Mindfully Me Counseling. And then I'm going to let Mr. Rubin introduce our sponsor who is currently on the podcast with us.
Okay, well, I had the opportunity to work with Miss Sierra Soros. She was my clinical manager, and I learned a lot from her. A great clinical manager, and remained in contact with her. We remained friends. They all call me Grandpa, which I think is very endearing. So we maintain communication, and she was nice enough to let us use her facility to meet there and do the podcast. Right now, we're on different links, but we try to meet there at least twice a month, and she let us use her facility called the Healing Place. And as she said earlier, they offer a lot of services, and I like that because one of the things I was impressed with for for uh, for the disadvantage, or what, I don't like to use that word. They oftentimes like have personal hygiene products for women and what have you. So I think that's important. Some people might minimize that, but I think that's very important. So they offer a lot of services. I'm glad that she's a sponsor of ours.
Absolutely. She has been phenomenal. In her facility is where we host our podcast in Sanford, North Carolina. She's been absolutely an amazing individual supporting us throughout our technological difficulties, but much respect for her. And actually, it's a great opportunity for even her to be on board. And I definitely want to hear a lot more about you. I know we said that, you agreed to come on and interview with us, but I don't want to turn it into an interview. Okay. I want it to just kind of be just, you know, typically, human relationships, right? Just a genuine conversation. I want to know more about you because we're going to be putting your logo on the podcast website and you host us. So I want to know more about y'all's businesses. I want to know what you offer and whatever else that you think is relevant. Like what type of diagnoses do y'all serve? Many things like that. Whatever you think is relevant. That's what I want to know. Yeah. So the floor is now yours.
Okay. So we offer, of course, mental health and substance use. We a lot of times we collaborate a lot with task or probation or DSS. Some of the community, I like to call them challenges or barriers that we kind of see as it points to like accessing mental health. We try to make sure that we create a space where they can kind of thrive past those barriers. So we do offer like Spanish speaking. We have different things that our closets have. We we are big advocates on harm reduction. So we do have a syringe exchange. We also have Narcan on site. We do to advocate for to reduce STIs. We offer free condoms at all of our facilities, and we also provide them with sexual education courses and things like that to kind of help them feel empowered as they explore their relationship options in the community. All of these things are not tied to any type of mental health service, so you don't have to come there and you don't have to be a client. You could just be in need. We do different type of community engagements where we'll do like a needs assessment. Ruben will tell you I'm really big on those. And so in that we will identify some, I would like to say maybe some necessity items that they can't access. That could be household cleaning products, maybe winter attire like coats and gloves and things like that. And then we will advocate and market it through the newspaper, radio stations, or different type of agencies like the health department and things like that. So they could be aware of when they can actually come to the facility and pick those things up. Again, that is not tied to any mental health commitments, although it is a very embracing environment and we're very open to that. We don't make them write their name down or anything. We don't take any of their contact information unless they inquire. So that's something that, we just really enjoy. The program that program thrives from the nonprofit side, which is social works, and that is being social works, living social works, and doing social works. And we're big advocates of that. I do have a social work background, so I'm very need based. I love getting individuals to the resources that they need. A lot of our individuals that come through, maybe through task or probation, they do get the opportunity to explore some of our independent development. And we do that also for our co-occurring for IDD. So we help them with identifying a job or maybe identifying local community resources that help them meet their basic needs. We think that's very important. We do a lot of our structures based off the Maslow's hierarchy of needs. So we understand that if those foundational skills are not met, then we're probably not going to have a very thriving mental health space. So we definitely try to kind of meet them where they are, get them to where they need to be so they could be as successful as possible as they explore their journey for mental wellness. And we just try to get different type of clinicians. We make sure that the clinicians have the same type of spirit that we have and they want to see the same type of outcomes that we do. We are not driven by numbers or anything like that. Is truly by outcomes. So we are very intentional about the way that we match the client with the clinicians. I'm very engaged throughout the whole process. Majority of the co-founders are. So we try to, we just try to make it feel homey. We want you to all feel like you're at home and you have the freedom to explore and really just experience the full capacity of mental wellness. So that's kind of what we do. There's not really a diagnosis that we don't support. We have a large variety of dual licensed clinicians or client-specific clinicians that kind of help support individuals from veterans like myself. So that's always been a heart space for me. That's actually how the company even started. And then also just like individuals that's struggling with trauma. So we have a trauma-informed care development thing is pretty much based off of that. So we support each individual and their needs, and we kind of create a trauma-free space. So that's something that I think is great. So everybody that you see has a smile on their face. They're happy to see you, even if you're not happy to see us. Maybe not today, maybe tomorrow. And Ruben will tell you, I'm really big on that. So I try.
She is definitely,
to make sure, like even if, you're having a bad day, when you see me, you're like, okay, maybe she can turn it around. So yeah. So I mean, that's the company in a gist. And I guess about myself, I just said that earlier, but I am an Army vet. I'm medically retired. I have 7 beautiful children, 6 boys and 1 girl. The girl is the very last one.
She's adorable too, I must say.
She is definitely a sight for sore eyes, and she has a lot of personality. And the boys they're very smart and creative. But yeah, so I have my military background is more so in communications and transportation. So that was a great experience. And then I didn't really go into the mental health field originally. I was going kind of the legal route. So I have an associate's in paralegal. So documentation is always important for me. I love proper documentation.
Yes. Yes.
I'm really big on that. I am a published author. I have written articles for SAMHSA that's been published in their disaster planning sector of their I guess, of their agency organization. I mean, they're really big. So, and then I have published articles as well for the NASW of North Carolina. And then in honor of Black History Month, I have a children's encyclopedia called A Day with Grandma May. And it's like you go on a little journey with your grandma, and, you know, she's teaching you about all of the great inventors that were here in
Oh, okay.
America. And it's a beautiful story. My kids actually colored, and my husband drew the pictures, and then my oldest one is the one that does the digital part of it. So he graduated from college with his information security. So I make him do it. It's like it's the least. I mean, it's not like he's going to pay off my house or anything. Just upload these for me. Yes. Yeah. So I'm very family oriented. I love family. I love creating new families. I'm I'm very big on that. I've never met a stranger, and I don't take too keen of creating enemies. So I guess that's just me in a nutshell. I'm probably forgetting something, but
Hey,
if you ask me
that'll
something,
be okay. That'll be okay. Well, no, and I'm actually glad that you shared that information because I did not know none of that about you. When Ruben told me about you, he left all of the other stuff out. So, Ruben, I will mute you if you start talking. Don't start talking.
I gave you the humanistic, which is also a part of what she told you is important too, but I gave you the humanistic side of her. Maya Angelou always says, you won't remember exactly what a person said, but you remember how they made you feel. And that's how I remember, most important, what I remember about Sarah is that warm feeling. And I learned from her to even to grow and become even more compassionate. So that's why I didn't tell you all the other stuff.
thank you.
Yeah.
Ruth.
Well, no, but seriously though, and Trevor, if you want to say something, just jump in, man. Like
Yeah.
we're just messing around right now. But no, I like the fact that you shared with about the needle exchange program,
Mm.
and I think that's important to really understand. I was reading a statistic, and Ruben knows I'm big on statistics.
Yes.
Also, I think I'm more so the longer that I practice, I'm more qualitative than quantitative. And so I wanted to read this. This is from a national survey on drug use and health. It says that in the context of intravenous drug use, it is important to note that African Americans are overrepresented among people that use drugs in the United States. According to the 2018 National Survey on Drug Use and Health, 13.7% of African Americans reported using illicit drugs in the past 30 days, which is higher than the national average of 11.7%. Yes, I know that is an older statistic, right?
Mm-hmm.
But when we look at the IV drug use, which is, is one thing to, me as an addictions therapist only in North Carolina, it's one thing to smoke pot. Like I'm cool with, if patients want to smoke pot, that's on them. If they don't want to, we can treatment plan it. Totally up to them. But what is much more severe, right? Like present immediate concern is the IV drug use.
Mm-hmm.
And when I look at that number, that's just drug use, right? IV drug use. That concerns me. And so we need more agencies and more entities, more organizations that are doing the needle exchanges like yourself.
Definitely
important to address. Yeah. So that really shocked me when I heard that because a lot of people are afraid to implement a needle exchange program.
So in lieu of that, my perspective personally is just the idea of just continuing the usage. And that's a touchy subject for me because I'm trying to comprehend the idea of helping them to continue that behavior and that mental issue. So seeking the proper assessment to those sources of the programs that will help provide them with mental issues, however they're established in their behaviors,
Mhm.
is critically more important, because thinking that you can continue to use those substances is not, to me, in the best outlook on their well-being.
Okay. But I think
Yeah.
while they're
Here,
using, when I was in New York, I worked in an abstinence-based outpatient program, and then I also was a hospital-based. It was a hospital-based clinic, so I had the opportunity also to work in medication-assisted treatment, and even within those domains, you had people who would say, "How could you?" Colleagues of mine, how could you work in like harm reduction? They believed in total abstinence, but I had the opportunity to grow when I had the opportunity to work in medication-assisted treatment, because we do also talk about harm reduction. And, if a person gets a set of clean needles and all that, I think that reduces the risk of HIV, hepatitis, and all those different things. So, ultimately, most of my patients who practice harm reduction say that they do want to achieve abstinence from fentanyl, but along the way, along the journey, I compliment them, I commend them for each small step they make. You know what I mean?
Yeah, and I'll say that, I think the misperception with harm reduction is that we are encouraging the behavior,
Right.
right?
Yeah.
But we're really encouraging the opposite. So it's kind of like we're encouraging the behavior of seeking help. So it's a habitual pattern, and eventually they are already exposed to things that they typically would not be exposed to. So by coming in to get the needles, you're exposed to people that believe in you, people that believe that you have the ability and the power to seek support to change, and that you have the ability to kind of surface or reestablish your hope to drive the change.
Hmm.
So, but in the meantime, what we don't want is for you to potentially overdose or find yourself suffering from HIV or STI that could have potentially been prevented if we would have provided you with additional resources. So
Hmm.
even though we don't want to encourage you to continue to use, we do want to also encourage you that while you are on your addiction journey, to try to be as safe as possible. So sometimes what looks like recovery for us, it will not look like the same for them. They may have
Yes.
the idea or they
Yes.
may have the inkling that they want to recover, but they just have not found the mental or the physical capacity to do so. So we still want to be able to support those individuals as well, because they still matter too. So, and that's a lot about what I mean by like trauma informed care. I wasn't as knowledgeable about harm reduction, honestly. It's something that I had to seek knowledge about.
Hmm.
I probably started off much like Trevor, like, I kind of feel like that contradicts the purpose of this. But it really doesn't when you look at it. The way that they feel, knowing that we see them as a person and we see value in their life, even though they're suffering from a disease that may feel more powerful than how they feel right now. We give them a sense of humanity, like we bring a sense of medical scope of view to the disease. And I think that in its all, I think that in its all of its capacity provides them with the ability to see that I am suffering from a disease, even though I'm being penalized legally, or I'm being penalized, socially or economically, I am actually suffering. And these people see that I'm suffering, and they want to help me. And so by introducing that type of environment to them and normalizing the disease for them, because majority of the time, their community has normalized illicit use to some capacity.
Yes. Yes.
And so we provide them a space to come to be seen as they are and to hopefully be seen as they could be. But if not, let's not create bigger issues of HIV, which you're not going to get maintained and monitored because your disease takes priority. So taking your medication is not that important. STIs, meaning that we're just going to continue to spread them because we are not as aware of our body adjustments because we are heavily intoxicated or inebriated. So then by giving them these other tools, we teach them not only to be more conscious, but also to kind of have more care about themselves as they explore the challenges and barriers that's associated with their disease.
That makes good sense to me.
I'm sorry, I didn't get it all, Mr. Trevor.
I'm sorry. The cessation makes complete sense to me, especially from the medically pronounced view of it.
yeah.
Just kind of you'll use time that mental state can be you're being.
I think you were breaking up.
We're gonna fix that, Trevor.
We gonna
Don't
fix,
worry.
dude. Listen, if we have to ship you a computer to your house, that
Right.
is okay.
We're gonna
It's
fix
okay.
that.
We're going to fix that.
Right.
It just makes me a little bit fearful of the fact that the continual use of the sub of mental challenge.
Well,
There's
I think it's
a progression through it, you know.
Well,
Yeah.
I think it's important to understand that, a lot of people when it comes to opiate use, right, or IV drug users, let me use those. And I'm gonna generalize here. I probably shouldn't do it, but I am, and this is less of a clinical, but more of a personal kind of of a statement here or belief here. But IV drug users are the chances of relapse on IV drug users is significantly higher than those who, are just using or just snorting cocaine, smoking marijuana, just drinking alcohol. So when we look at the relapse, right, the relapse rates compared to other ones, and let's also look at the as you were saying, Ms. Sierra, the level of HIV, the level of AIDS, the level of these STDs. When you look at all of those things, how can we reduce that? We're also looking at economical impact on it, on the community, right? And so, I think the question, there's a lot of questions that I had to learn myself, like you. I was dead set against harm reduction. But when I start learning all of these facts, right, like we reduce the economical impacts, we reduce the chances of somebody being reincarcerated, right? We reduce these chances across the board, not just in one domain or one area of somebody's life. Opens the door and the opportunity to bring families back together, right? Especially when we look at the Black community or the African American community, which the war on drugs has totally devastated. I mean, cocaine is only the only reason cocaine was made illegal is because African Americans in the minority populations, Hispanics or Latino, whichever one you want to go with, Asians, all of those minority populations started using cocaine, right? So the war on drugs has devastated, and so it went from being a parent or a mother and father household, right? The Black community and many other minorities went to being just a single mother family home, right? With the dad in prison. If we look at prison populations, most people in prison, African American guys, right? And so the concept of harm reduction, right? Not just abstinence based, but you factor in abstinence based and harm reduction programs and principles, you bring those together. And so what happens is we're able to reduce incarcerations, we're able to reduce recidivism, right? We're able to increase somebody's chances for a successful life, in recovery. Instead of spending, $100,000 a day for one person in jail, well, they're using a needle exchange program. They're not shooting dope every day, or they're not IVing dope every day. They're maybe snorting cocaine 2 or 3 days a week, right? So it helps them to get on that path of recovery for certain people, depending on where you fall at on that continuum. And so it's not just looking at it from an abstinence-based approach. It's looking at it as what is going to work for each individual in his or her own lifestyle across the continuum. I've worked with many folks, and I'm in with this, I'm going to let somebody else pick up, but I've worked with many folks who had tried to get sober in AA or NA or church or whatever all of those other programs are. There's so many abstinence-based programs, and they just kept relapsing and relapsing and relapsing and relapsing and relapsing. And yet when they get into some type of medication approach or whatever, right, whatever you want to call harm reduction, whatever can fit into that bowl, these folks, their life flourished. They were able to get jobs. They were able to, pay off debt. They were able to have a stable family. They weren't in jail anymore. They weren't craving it. They weren't thinking about it every day, all of those things. And so that's, those are things that I had to learn myself. And it was through not just reading, but direct experience.
One of the things about podcasts is we don't all have to agree, and
Yeah.
it becomes organic. And one comment that you made, and I was watching a judge one time, one of these TV judges talking about that. I mean, one of the defendants was saying that about the most of the men in prison are African American. He was saying it's just for the population, our percentage in the population, we're probably at a higher ratio. But I don't think most men in prison are African American. I just think we're, because of, compared to the population, our percentage in the population, that we're at a higher ratio. And even we talk about mental health. I think that's why I'm glad Sierra's here. They said one of the barriers in the African American community, and again, African Americans are not monolithic. I can't speak for the entire African American community, but I can just say my experience is that one of the barriers is you want to go to a therapist who looks like you, who you can relate to. And not saying you couldn't relate to a Caucasian, anybody else, but a lot of times it would be great to have cultural competency. So I think Sierra being here and having that entity in Sanford, and I think another place too is Laurinburg, I think. Yeah, I think that's important because that's a barrier in the African American community. I think a lot of times, growing up, I remember I grew up in the '60s and the '50s, and I mentioned growing up in the segregated South and them Jim Crow. There was a lot of strife and hardships and overt racism. I used to see my parents. One of the things that, no matter what they endured on the outside, my father felt very important in the black church. So I think a lot of times African Americans, instead of doing therapy or counseling, they start mental health through their pastor. So I think a lot of agencies and mental health providers in the black community are getting with those entities like the church and what have you, because they recognize that's a strong base in the black community.
Yeah. Real quick, folks, I want to take a moment and recognize WebHash. This is a organization that we support. I'm actually secretly trying to get them to be a sponsor of us. I think they know that, but no, seriously though, all jokes aside, we support WebHash. How can we support WebHash? Because it is a no code decentralization website building program. They have an amazing. They have over 100 templates for your websites. Of course, you connect your wallet to it, your decentralized or centralized wallet to it. It is you can do $5 a gig plan, or you can do. I think they have a lifetime subscription right here if you buy the Nerdle NFT for 0.069 ETH. It's probably actually higher than that, but you get lifetime. It gives you a lifetime subscription, and then after you, I think it's like 300 megabytes of memory that you get for your website. After 300 is up, you have to pay for more memory, so it's $5 instead of $15 or $20 like most other organizations offer. So again, it's WebHash, this logo right here, webhash.com, Web3 blockchain technology. Go ahead.
So, Sierra, what do you, being a mental health provider in the community? What do you see? You can speak on that. What do you see some of the barriers for us in the black community to treatment, or the stigmas, or what have you?
I would say that what I find is that I guess I would say one of the biggest barriers is probably judicial intervention for addiction disease. I would say for that. And also for mental health. Mental health in the Black community is often penalized depending on the strength of the person. So if
Yes.
I am a person that has depression, and I am more likely to be violent when I am suffering from my irritability, or if I have bipolar and I happen to be violent before I go into a manic or a depressive state, I'm probably more likely to end up in jail than I am the hospital.
Yes.
So, but on the flip side, it goes both ways because a lot of times from what I see is that when we talk about like statistics and statistical data that, when we consider overdose in North Carolina, and I'm going for my doctorate, so a lot of my information is from 2022. But with like 3,500 individuals just in the opioid sector, right, suffering from opioid overdose and resulting in death in North Carolina alone. And
Hmm.
so, out of a large portion of that was actually the white race. So I think that because it is not taken and it's not penalized, they are at more of a risk of the overdose, if that makes any sense. And then
Uh-huh.
and then all the way down to, and then I just think that because the Latin community is often neglected because there is not a lot of bilingual support for addiction. There's not a lot of bilingual support for mental health. That's why their overdose rate is so high. And then there's a lot of other factors that contribute to the overdose rate as it applies to the Black community and how it is monitored and reported. So that could also impact the data as well. But I think that overall, the system itself and the way that it tends to mental health and it tends to addiction is so skewed that
Hmm.
it happens to impact significantly across the board. So
Hmm.
when I see addiction and I see mental health, I see that a lot of times, a lot of the resources are limited to the Black and Brown individuals, mainly because if you speak Spanish, that's your primary language. There's not a lot of, in North Carolina, I will say,
Yeah.
there's not a lot of bilingual services to help you kind of process that. And they do have a higher potential risk of child molestation, to say child abandonment, but I may potentially leave you with your aunt or your cousin or your sibling due to
Hmm.
legal factors as far as my citizenship here. But you can go stay with your aunt because you'll probably have a better life here than in my country, right? So
Hmm.
then there's a lot of that happens and it causes a lot of disruption in their households. And then I think with the Black community, I don't know if there's a full understanding of mental health. A lot of times if you are in an environment that's saturated with trauma, you don't realize that you are traumatized until you're
Yes.
taken out of that environment.
Yes.
So a child can experience a shootout, they can experience and this is any race, but just to focus on
Hmm.
that demographic, they could experience any type of what would be traumatizing to anyone if you watch your parents be incarcerated or you watch your parents engage into any type of physical alteration
Hmm.
or what have you. And then they go to school the next day. And if they are not attentive in school the next day and they're not provided an IEP or then they are suspended because they're not attentive and engaged. They are more likely to get a 504 than an IEP for having ADHD or ADD. And the Black community children that have issues with social structures are more likely to receive a oppositional defiance disorder diagnosis,
Yes.
which also sets them up when they may just have autism or they may have a cognitive delay.
Hmm.
So I think that sometimes there's a level of assumption when it comes to certain evaluators of diagnosing. And I try to encourage, that and when I provide supervision and things like that, to focus on the DSM-5. And
Hmm.
although the environmental factors are there, use those to eliminate the potential of misdiagnosing, but don't use those to help diagnose. So I'm not going to give someone PTSD just because they experience being in a crossfire because they may not be traumatized.
Hmm.
That
Right.
may be their sense of normalcy, but they may have a severe case of anxiety, which may make them look defiant. And it may make them look like they are having struggles with structure when they may really just be depressed.
Hmm.
So, and I think that is probably kind of where I see as it applies to just the Black and Brown community. When I look at it that way, that's how I see it. Like
Hmm.
sometimes it's the diagnoses are a little more aggressive. It's like, so when they come to me, they're like, "Yeah, I have PTSD. Are you having night terrors?" They're like, "No." Okay, well, are you in a situation and the threat is not around? You feel like it's still there? No. Are we sweating when we think about it? No. Okay, well then baby, help me get to the PTSD because I'm trying to
Hmm.
I'm trying to follow you. So And that's very common, more than not. So it's like there's a lot of things that help us rule it out, and we're still ruling it in because we look at the situation and the environmental factors. Like, I would be traumatized. You have
Sure.
PTSD.
Sure.
But the reality is that's their level of normalcy, and it does not impact them the same way because their environment kind of makes them feel embraced by those things. They don't feel isolated or individualized, should I say, by those barriers. So I think that will probably be the main thing I see is by the time people get to me, they think they have a whole slew of mental health diagnoses and I don't see them.
Yes.
And I apologize to them. I'm like, I'm trying to find this schizophrenia, baby, but it's not there. So I guess I would say that's probably one of the major things that I would say is just the misdiagnosing. I think that sends us on a journey, and it's nothing like giving someone a modality for support. And of course, it's ineffective because that is not what they're struggling with. So, if that makes any sense.
Trevor, did you want to add anything?
I think he's trying to work it out.
No, I couldn't really get to the details as well as that, but it generalized the problematic conditions exist in the community, and I understand that. I've lived and seen it because I the Black community at a young age, and thank God for that because that established solidly my spiritual.
Oh, okay.
And so at the same time, I experienced the exact same things, even to a more extensive bad point, because when you're the only Caucasian family and 2 miles around you, you got Colombian and and Latino and every kind of community that's around you, a more problematic situation. And I just thank God that I swear my spiritual experience was solidified by the people that love.
So you was a minority within that community, right?
Absolutely. And your grandfather did to my grandfather this, and I just thank heal me, have an open respect.
I didn't get the last part.
We're going to, like Kevin said, we're going to fix that. Then we have to send him a laptop or something.
Right. I especially refined it in the, when I worked as a correctional officer.
Mm-hmm.
Was it where Kevin, you had said something about $100,000 a year when they are getting a 48-cent meal.
Yeah, you are breaking up, my friend. You completely froze.
Don't get
right
frustrated.
there.
Don't.
Hold on. I'm gonna turn your camera off.
Okay. Can you still hear me? Anyways, no, I'm thankful for the opportunity to be part of this and help support the Black community because they have things that really need to be addressed. Camera off. I have an appointment coming in here momentarily.
Hey, you are
okay. I think he has an appointment coming up. Yeah. Yeah. Okay. Okay.
Where did Kevin go?
Yeah. What happened to Kevin? It's me.
I think he was trying to turn. Now he know he can't leave us unattended. We might have a party.
I like to have fun and dance. I might put some music on and start dancing. But I think what you said is true for us. I know growing up in the 50s and 60s, I saw that in the Black community. Like domestic violence, for example, was kind of, I'm not saying it was kind of accepted by the woman that, and then when you grow up in that environment, you become a child becomes hyper vigilant. And then you go to school and talk about it. Then the next day, the teachers at your house saying, "Oh, you went to school and you talk too much." You know what I mean? So, but I think all those things, those strifes, those things, oftentimes the challenges and the pressure and all that. People talk about racism and all like that. A lot of people are uncomfortable talking about that, but it still exists. And I think those can be barriers because a lot of times you just feel like I'm not going to seek treatment for various reasons. You feel like I might be misdiagnosed or what have you, and so I think it's important to like this topic, mental health in the Black community, mental health awareness generally, is so broad and intensive, and you couldn't definitely carry. You can go on for 5 or 6 hours and still not touch all the bases.
Right, right.
Nah, I know. I don't know what happened there, folks, but it kicked me out the room.
I said,
It was just
he left. I said, he shouldn't leave us unattended. We might have a party.
right.
Yeah, well, see, that's the interesting thing about having Spectrum Internet. It just was soon. The thing about between fiber optic internet and then regular internet, what happens is when there's an instability, it drops. Everything drops. The thing about fiber is it's stable, right? Or it's at least significantly more stable.
Okay.
And unfortunately, they don't offer fiber in the area that I'm in, and that's the sad part about it.
Can't have it
I
all.
told Kevin he has to, some point, like for his podcast and the technology, school me as well, because God forbid if something happens to him, my podcast ends. So I have to know all this stuff just in case Kevin's not around.
Right.
Well, see, you have to remember though, right? This podcast, all the website and everything is Web3, right?
Yes.
So everything is in one of my decentralized wallets for crypto. So you have MetaMask, Coinbase, Uniswap.
Yeah.
You have all of these crypto Web3 wallets, right? So everything, the website, the domain, everything is in an NFT, which puts it on blockchain. So that's the interesting thing about the website. So looks like you and Sierra, if something were to happen to me today, you and Sierra would have to go to the website, copy everything, and put it on a Web 2 platform.
We figure it out somehow.
Oh, yeah,
Don't
for sure.
leave it up to me. I know my strengths. This is it.
Well, nah, it's interesting. Right before I got kicked out, Trevor was saying something.
He has to leave. He has an appointment or something like that. Yeah.
So, but I was reading something because you mentioned a lot of barriers. And so I was reading something in the Black community, right? Or African American community. It says they were able to identify 5 main categories. This is a research study from 2019, right? They said the 5 categories are cost, which is broken down to primary like responses. So individuals reported they could not afford it. Their health insurance does not cover mental health treatment, or their health insurance does not pay enough for mental health treatment. Number 2 was stigma. They said that the primary responses were neighbors and community might have a negative opinion of them. It might have a negative effect on their employment. They did not want others to find out. They were concerned about confidentiality. They were concerned about being committed or being forced to take medications. Number 3, minimization. A lot of people in the African American community did not feel the need for treatment at the time or thought that they could handle the problem without treatment. Number 4 was low perceived effectiveness of treatment. Many individuals thought that they didn't think services would help. We're going to come back to that because I think that is critically important on what I'm fixing to actually say in a moment. And then number 5, accessibility, which I know you touched on, Ms. Sierra. Accessibility barriers. Most responses were no transportation, location was inconvenient, did not know where to go for services, or did not have time. And I think for me, the most important ones in this is the insurance is something we can talk about all day long. We can't make any change in that. But what we can do with business and community relations, right? Change is the last 3. And I think the reason I say that is because Ruben and I actually put this in my dissertation too, Ms. Sierra, that they did a research study during the middle of COVID, right? And they found out that the individuals who were least likely to take the COVID vaccine, and politics aside, I don't want to get into the political spectrum of COVID. That can go 100 different ways. But they found out the reason for the African American community, most especially, and along with a few others, but it was primarily within that community, is because of the Tuskegee syphilis study. That because African Americans were forced to take the syphilis vaccine, contracted syphilis, and the federal government refused to provide adequate medical care for them even after the cure had come out. They still refused to provide adequate, appropriate medical services. And so, I think that, do I think that study impacts trust in healthcare across the board with all races? Absolutely. But do I think
Mhm.
it impacts the Black community more than, the Caucasian community? 1000%. I absolutely do. And so I do believe that it is critical for us to get to a point where we have to rebuild the trust between people and healthcare.
No, I definitely agree. I think that as we start to have more access to social media, good old WebMD, and and Google, but as we start to have that access, and just the idea of holistic care and what that looks like, I think people are kind of in the middle space. I think that it's important for us to do more educating before we just distribute anything. I will just say that, and I think that kind of helps kind of create more of a segue for treatment, for any kind of treatment,
Mhm.
but there's a lot of information out there. Some of it is really, really good. And then some of it is misinforming and misleading. And it's very difficult to tell the difference between research based, evidence based, and then clickbait. I don't know.
Yes, right.
So, as we start to grow and people start to kind of having more access to more information, that's a scary place to be in. And I think when COVID came, a lot of people were quarantined, so the internet was their best friend. Our kids
Yeah.
were doing school on the internet. We were working from home on the internet. Well, not we, me and Ruben was going to work, but
Yeah.
we was definitely at work. But, and so much to say, but I think that type of access has really created a strong narrative of mistrust with the government, the healthcare system, a lot of the commercial healthcare insurance agencies where I thought it was just a me problem, it became a us problem. And the more people I seen were being mistreated or received any type of maltreatment through medical practices, it just kind of helped us all intertwine. And
Mhm.
and so a lot of the gray area was not communicated. So then I feel like the internet has a way of bringing people together, and it also has a very big way of tearing people apart. And so,
You're dividing people. Yes.
right. So
Yeah.
when I think about just the COVID vaccine, in general, that's what kind of brings. I know it was not really an option for our agency, and because of the type of environment we were in, that's just
Yes.
what it was.
Yes.
But I also couldn't tell you anything about the vaccines I took as a kid. I can't. So I just figured, well, I made it this far. But
Right.
but
Hey, you guys,
but
on there.
hey, oh, you sound good.
Yeah. I took the polio vaccine and all those coming out when I was a kid, and took the sugar cube with whatever, and I remember all those vaccines, and I just took them. So when COVID came about, when working in this environment with a lot of patients, I just thought it was no brainer. I need to take the COVID vaccine, and people said, "Well, 10 years from now, you might come down with, you might become sterile or something." I'm saying, "Hey, look, I'm 68 years old. I'm making any baby."
78.
I know.
Yeah. So I just think, just to kind of piggyback off of you, Kevin and Ruben, I think that a lot of it is, we have to be mindful that everybody has access to a lot of information. And if I'm not able to decipher
Yeah.
between what's accurate, what's inaccurate, what's kind of accurate, I could probably do more harm to myself trying to advocate for good.
Yeah.
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 I think as a African American, though, that stigma about going to seek mental health. But I'll share at some point I did working in New York. I remember my director of the program always used to say, uh, you should experience the other side. Like, if you're a therapist or a counselor, you should see what it's like to be involved in therapy or counseling. So when I moved here, I did seek a mental health provider, and luckily she took my insurance, and it was a good experience because it just helped me as well. Because when I first became a counselor, I thought my role was to have a session with them, and by 3 or 4 sessions, that have it fixed and say, here, this is what you need to do. Here's the gift I'm giving you. Now you got to be cured. I learned that's not what therapy or counseling is about. I learned to be a good listener. Me being involved in therapy, it really helped me because when I moved here, and I shared this before, at 18, moving to New York was a transition to the neighborhood my grandmother lived. But after 40 years of living in New York, moving back to North Carolina and moving not into my hometown of Salisbury, but moving to Pinehurst and Southern Pines area, not having any friends, going to a job that I didn't know anybody. That was a trend. I wasn't really comfortable with technology, and that was a transition. And I got extreme anxiety and panic attacks. And I remember going to the director at that time, 12 years ago, who was a director, and saying, I'm going to resign and move back to New York. And my wife was like, Ruben, if we move back to New York, I'll support that. But eventually she says, no, Ruben, I won't take you resignation. Give it 6 months. And I learned I had to work through the anxiety and became comfortable. And just so many things I had to work through. I had anxiety to the point where I would come home and just, I'm sure I was not a good person to be around. I'm usually joyful, but I was depressed and didn't eat much, and I love to eat. And all those things affected me. And for a short period of time, for like 6 months, I realized, you know what, Ruben, you have to go on some type of medication. Now, I'm not afraid to share that. The doctor prescribed me Lexapro, and it helped me to work through that anxiety and other means I had to implement behavioral changes and what have you. And so now, 13 years later, I'm still learning technology. Instead of hating this job, I love it. At 68, I still want to work another 20 years. So I had to work through that anxiety and stuff like that. But it was a struggle to seek a therapist in the beginning because of the stigma.
Yeah. Well, no, I definitely would say that there's a lot of things that, even from a Caucasian perspective, right? Like, there's a lot of things that I don't share. Like, about me, right? Like,
Yeah,
about my doctor's appointments, clinic, anything that I do, right? But
yeah.
I think even as when it comes to employers, right? Like, there's a stigma of seeking help when it shouldn't be a stigma. Years ago, I'm gonna share this personal story, right? And Sierra, you probably have heard this if you know if you know about Ruben, but like, we talk about the stigma with the minority population, and even, I consider myself also part of a minority population just because of, past life experiences. But part of what, I have to be mindful of is, or I guess be mindful of is, I worked at this one employer, and the program director did not understand medical diagnoses at all. And I still struggle with a medical diagnosis called dysphagia, where it's hard for me to eat. I used to weigh 180 pounds. I'm pushing. I think I dropped all the way down to like 125.
Don't brag, Kevin.
Right.
Don't brag.
Well, that was a medical diagnosis. I couldn't help it. I couldn't eat.
Yeah.
You got
used
the
to weigh
opposite of that.
280 pounds?
Yeah, I used to weigh 180 pounds.
No
And so, dead serious, man, about 4 or 5
Wow.
years ago. And so when I was struggling to eat, I had friends, families, and even my employer at that time had accused me of doing cocaine. And it's like, because I could not swallow food, and if I were to swallow food, I would literally choke, and it all come back up. And so I still struggle with it, right? So when, I'm glad that we actually decided to do, Black History Month, or honor Black History Month, and being able to talk about the stigmas associated with mental health, medical, all of these things, because things happen. Like, it's
Yeah.
real life deal. You know, I've served a lot of folks, and I think through my clinical experience, and y'all might be different than I have different experiences, but I have met more so African American communities and Hispanic communities more so than the Caucasian communities. But we would talk about their, hey, you have any trauma? Well, yes, I do have trauma. Oh, well, did you seek any help? Well, no, I didn't seek any help. And it's like, okay, well, how come, right? Because we're doing the assessment. Well, how come you didn't seek any help, right? Well, because my mama said that it was all in my head. My dad said it was all in my head, or my granddaddy, my aunt, my uncle, so on and so forth. And it's like, and so we talk about the ongoing generational concerns. You can call it trauma, you can call it what have you, but it's like, let's get away from that generational stigmas and say, hey, child abuse is real. Post-traumatic stress disorder is real.
Yes.
Schizophrenia is real. Bipolar is real. Substance use is real. And not everything that appears to be a mental health diagnosis is a mental health or substance use diagnosis.
There you go.
Because it could be just regular stress, or there's a genuine there's a genuine medical diagnosis that's behind it. And so for me, I have to be aware of, and when I do my assessments, I will write up, clinician is unsure of, give you an idea here. So if I'm doing an assessment on either one of us, I will write, clinician is unsure if, patient is, struggling with whatever symptom, or if this is an actual medical diagnosis. Further assessment is recommended. I will literally write that up in my assessment, just because, like, I don't want to put that stigma on the individual and say, hey, this is it, when it's 100 other things to go with it.
And that's a good point, because that diagnosis, I remember, it stays with that. It follows that person. Even when I do on my own, do DWI assessments, and we have to render a diagnosis like substance use, alcohol use disorder, severe, moderate, or mild, and sustain, all those different things. We have to make sure that, because I don't want to put that label. I hate labels, and I don't want to put that label on a person, but that follows them with insurance and all. My phone is at 10%, so if I cut off, it's literally at 10% now. So
you should have had it on the charger, son. You should have had it on the charger.
I know.
Don't be blaming us, and your camera's completely
next
off.
Next week I'm gonna get a laptop. Go to Best Buy.
But your camera's off. Okay, if you get a laptop, get an Apple. You have to go with Apple. If you go with a Microsoft, you're off the podcast. I'm just saying.
Apple is great.
I'm just picking.
Okay. My camera's off?
Yes, your camera's off.
Probably because
my phone is dead. Sierra, it was a pleasure having you on this podcast. And again, thank you for all you do to help us. I mean, you were just open and said, no problem. My clinic is at your disposal, and I really appreciate that.
Absolutely. Listen, I want to close this out with a couple of things here. I'm going to start us off with, let me see, there's Thurgood Marshall.
Okay.
There's a quote by Thurgood Marshall, and I think this is kind of like where we're at.
A renowned Supreme Court justice.
In recognizing the humanity of our fellow beings, we pay ourselves the highest tribute. And so the goal behind this podcast, regardless of what walk of life somebody's from, and with even through our technological glitches like today, I got kicked out the room. Trevor is not able to rarely say 3 words, right?
Yes.
I mean, now you can pick up mental what it is, and it'll be like, and then so we've had technological significant glitches today, but the goal of what we're doing is to help at least one person. And so definitely want to say again, if you go to Dubby, I want to give a shout out to our sponsors, Dubby. If you go to any product that they have, use the code OneMoment and you get 10% off. Again, you have Mindfully Me Counseling in the state of Texas with Patricia Hernandez. She is absolutely an amazing clinician. She's phenomenal at what she does. She is bilingual if you are looking for a bilingual therapist. If you're looking for a female therapist, definitely encourage you to go to her. I recommend her. She has been a huge supporter of this from about 4 or 5 months ago when we were in the process of building everything out. And again, you have WebHash, the website builder for Web3 websites. Definitely check them out. Huge supporter of them. I'm going to let Miss Sierra say whatever she needs to say because she's on the podcast. I don't have to introduce her anymore until next week unless she's there.
And then it's me, no, but Sierra Suros, representing the place to heal for all your mental health and substance use needs and also your necessity needs. So if you ever have a necessity item, you want to see if we're sharing it with the community, just click on our website, www.theplace2heal, where it has 2 O's because the healing is more important than the place.
Thank you.
Before you close out, I'd just like to say that I'd like to reiterate what Thurgood Marshall, and I knew the name, but I didn't realize that he was a Supreme Court judge.
Yeah.
In the ideation of this entire program, helped confirm to me that this discussion was primarily, we are celebrating History Month, but at the same time, Thurgood Marshall helped define it even more to the point that this is a huge part of the human condition. It doesn't matter what you are, where you come from, if you're a human being, and you've got all these necessary mental health issues, that we want to bring that all to your attention, help you get the help that you need, just like all of us may need at any time of our lives. Thank you for letting me say that. I just to help reiterate.
Absolutely. Absolutely. Sierra, I'm going to let you take us out. You get the final word.
Have a great day, everybody. And always remember to smile and share happiness and love with everyone because it's another day. And regardless of where you are, you're still gold. You can bury gold in the dirt, you can put it in the mud, or you can put it in a showcase. It's still gold. Thanks for having me, guys.
Let me end this live.
Yeah, my camera's dead.